I think my experience the last 30 years and children with cancer and managing febrile neutropenia, I found that a lot of difference in the past and now, and also I found that difference in the region. Like in UK, where I was practicing a good majority of years, we found that there is a structured cancer care network where cancer care is shared with, as a team, the tertiary center and general pediatrician around the tertiary centers. So I found that at the same time, the same situation now in Australia, if you look at that, the distance is too far, the country is too big, the care is provided more locally, nearer to the patient's reach. And the tertiary care help is provided through what's called a telehealth medicine, where patient can have through Skype-like scenario where the patient can interact with the doctors and specialists and get an updated report. If you look at the febrile neutropenia management in developing countries like India, from my experience, find that a lot of people cannot afford to go and stay in the hospital, and so unless there is a public free hospital, and so many a time they would like to get a home-based treatment, and a lot of specialists there treat with oral antibiotics. Unfortunately, we don't have a lot of evidence documented data from those countries. So the present, coming to the second half of the question, yes, there are now international pediatric febrile neutropenia guidelines panel, which recommends a low risk group of children with febrile neutropenia with a low risk category. They can be managed at outpatient basis, provided there is a good communication and reliability between the child family and the treating local doctors. This is going to make a tremendous impact on the outcome of children with cancer in even the developing countries also. Right, I think febrile neutropenia management, one of the main thing is that unlike in adults, majority of the febrile neutropenia causes are fever of unknown origin. You don't need to see a lot of septicemias. So the breakthrough is that are we over treating these children? So the trend is to risk categorization getting more emphasized, unlike in the past. And that's real breakthrough, as it's avoid unnecessary use of antibiotics, and which can prevent antibiotic resistant germs coming out. That's one other breakthrough. The other thing is it become more child and family friendly cancer cares, cancer supportive care. These are the new things, evolving things happening in the children's cancer supportive care. I think the challenges depends on the child's, child's background, the child's and family background, and the child's and where is it from. My experience from developing and developed countries shows that these challenges are different. In developing countries, it is the resource lack which makes the child's access to the standard treatment. Whereas in developed countries, it is the psychological trauma, because there are facilities like in UK and Australia, you got all the facilities in the hospital setup, but the children would not want to come there because it's become an everyday business for children to visit hospital. So it's caused a lot of psychological stress and trauma to the child, and that results into the family also. The challenge is to treat the child as a total, not only the physical well-being, physical ill health, also the emotional side of the child and family. I think it's absolutely a very good question, because this is the forum where pediatricians from all over the world gather, and their experience varies with the geography where they are coming from. So if they get an opportunity to learn and to share about how this important condition which can be life-saving, can be managed with the local available resources and maintaining the quality and standard of the care. These sort of forums will be definitely the best venue to learn and to go back and start in their practice to help the children to become successful with the cancer.